Good morning and welcome to our weekly media briefing for COVID-19. I'm Kerri Schuette, the Public Information Officer for the Shasta County Health and Human Services Agency. We'll start as we always do with our numbers. We have 645 confirmed cases as of Monday, including 8 from Monday. We have done a total of 41,242 tests. We have 21 people in isolation. Those are people who have tested positive and are still in their infectious period. We've got 99 in quarantine. Those are people who are identified as close contacts of those positive patients. We have 3 people in the hospital, including 1 in the intensive care unit. And we have had 12 deaths. Here on the Shasta County side, we have Donnell Ewert, the Director of the Health and Human Services Agency. Dr. Karen Ramstrom is our Health Officer. Dr. Michael Vavakis is our Deputy Health Officer, and I will let Donnell introduce our other new smiling face today.
Thank you, Kerri. Yes, I wanted to introduce Robin Shurig. She has been appointed the new branch director for our public health branch in the Health and Human Services Agency. Robin comes to us with extensive experience. She's worked for our public health branch both when it was a separate department and as part of the HHSA for 17 years, more than 17 years, and she's held numerous positions within the public health branch in various divisions. So she has extensive knowledge of our public health efforts and actually headed up the division over communicable disease control for a while last year and has been the deputy incident commander in our COVID response. Previous to being appointed director, she was the deputy branch director. So I want to welcome Robin and introduce her to all the media as being the new director of our public health branch.
Thank you, Donnell. And did you have anything you wanted to share, Robin?
Sure. So I would just add that I'm also a Shasta County native. I was born and raised here, so this is my community and my people. And I look forward to just being able to provide support to all of our staff who are either involved in the emergency response as well as those who are back, at the public health branch on Breslauer, doing all of the mission essential functions that we have to keep doing even during an emergency. And many of them are sort of doing double duty to make up for staff who are dedicated to the emergency response. So I'm just looking forward to being able to support them through this crisis. Thank you.
All right, thank you very much. We also have with us today Dean Germano from the Shasta Community Health Center. And we are ready for, do any of our presenters have anything to share this morning before we open to media questions? Okay, then we will dive right into media questions. What have you got for us today?
I've got one very quick and silly question. On Monday, it said that the numbers were from Friday and Saturday. So on Tuesday, it was from Monday, but did that also include Sunday numbers?
Right. As of right now, we're not working on cases on Sundays. Things have slowed down just a bit, and so we are not processing cases on Sundays. So our Monday numbers reflect anything that would have normally come in on Sunday.
It's all clear to me now. Thank
you. Excellent. Glad we could help. What else do you all have for us today?
I have a question that's related, but maybe sort of unrelated anyway, maybe for Dr. Ramstrom. The smoke in the air, is there any concern about, closing schools or the school children or anything because of the continued amount of smoke in the air every day?
Right. We were talking about this just earlier this week. And so there was guidance for the school on what to do with air quality and keeping children inside enclosed building that has HVAC in place. So that's the safest approach for kids, for all of us, is actually to be indoors where there's good HVAC available. So the question always is, should they stay at school or should they go home? And it's challenging because we don't know what the situation is
is in their home environment, or if there's even anybody there for supervision. At this point, we recommend that kids stay at school and that the schools keep the kids inside when the air quality is poor. And there's specific recommendations out there that they use on a regular basis at the school level.
Would you be the one who would say, okay, students should stay home, schools are closed, or is that up to the individual schools and the school boards?
Yeah, that would be up to the individual school. And I think, we have a little bit more localized air quality monitoring available now. And so the schools look at that regularly based on their own individual locations. And they're able to see and go outside and also assess that way. So, and also to watch weather patterns, that kind of a thing. So it's really up to the individual schools to make those decisions. We're certainly available, and as are the air quality folks, to provide some technical support or talk it through, but it's up to the school to make the decision.
Thank you, Doctor.
Other questions?
Yes, hi. I have a question for Dr. Ramstrom.
We're ready.
Okay, yeah, I wanted to ask about visitation in hospitals for patients. I understand that now that hospitals are not allowing any patients, or sorry, anyone to accompany patients who come into the hospital, not even one person. So I'm wondering if your office is giving guidance in that area and when that might change.
So we just started to have this conversation in hospitals all along. You're correct that it's routinely not allowed to have visitors, but there are certain situations, such as in the neonatal intensive care and at the time of delivery and at time of death, or if there's an individual who needs assistance based on their own medical or developmental or age issues. So, but we are starting to look at that. We did that this last week, actually, for the skilled nursing facilities. There's specific parameters that came out from the California Department of Public Health since they licensed those facilities. And so we put out some guidance for our skilled nursing facilities based on our local transmission. And so we're looking at doing something similar with the hospitals and have just started to have those conversations. So we're hoping to have something available soon.
Okay, what was your guidance to the skilled nursing facilities?
It's largely based on the state requirements, which includes adherence to the current screening recommendations. They have to be testing their staff at regular intervals that are specified by the state. They have to have adequate supplies of personal protective equipment on hand. They have to be COVID-free for a period of time, and so we would be looking at something similar for hospitals. So we're sort of just starting those conversations and looking to see what guidance is out there. And then the last thing in the state guidance is based on local transmission. And so that's really the piece that we applied locally. And so it actually fits right in really nicely to the tiers. And so the orange tier that we're in right now, we feel comfortable that that's an acceptable amount of disease transmission for allowing visitation at the skilled nursing facilities, and think we would do something similar for the hospitals. But we're continuing those conversations with them, and it will be a joint decision about how we frame that. But probably similar types of parameters for the hospitals as we used for the skilled nursing facilities. And those requirements at the skilled nursing facilities, it's one visitor at a time, and there's parameters around how they do that visitation that's set by the state.
And when was it that for hospitals, visitors were, I guess, barred?
It's based on CDC guidance that came out, early in the spring. So it's been in place for most of the period of the pandemic.
Right. Okay. Because it seems that I remember that at some points there were visitors allowed, and then there weren't, and certain ages. So it seems like it's been a little fluid back and forth over the past weeks.
I think the guidance has evolved as we've learned about what are some exceptions that should be allowed, such as assistance to somebody that might either be a child, and so allowing a parent, or if somebody has developmental needs and they need their support person, that kind of a thing. So I think that has evolved over time as gaps in the original recommendations were made.
Okay. Thank you so much.
This is Dean. I was reflecting on Mike Mangus's question about the air quality, and I think people know my wife's a principal and educator. So I watched it in motion this last week. She routinely gets up at 5 a.m., looks at the particulate matter. There's a policy with her school board. If it reaches a certain threshold, then it's indoor everything. If it reaches a real critical level, then it's all distance learning. So it's determined by the superintendent, makes the call, and it has to get out early enough because you have school buses and parents and what have you. So it's really a complicated process to get that right, but it's always about safety of the kids, of course.
Thank you, Dean.
Welcome.
All right, other media questions?
Yes, I'm not sure it's answerable, but Dr. Ramstrom, since you and other experts have noted that infection rates tend to be greater in areas of less air exchange, of where the air is not flowing as much, is there a method or a standard for measuring the airflow in an interior space? And if so, would there be ways to lift restrictions based on that, or is that being looked at all?
There definitely are standards in medical facilities, air exchange standards, and I am not an expert on that, but those are used routinely in those types of facilities. And you know, you're correct that where there is more ventilation, we worry less about disease transmission. But I have not seen anything that takes that into account in how that would affect if you're suggesting like our level of opening in different types of settings. I haven't seen anything like that.
I mean, I could imagine people being more willing to go to a facility or a business if they have a higher standard of ventilation, and I'm just wondering if there is such a standard established.
As far as I know, there is not outside of medical facilities. Medical facilities do that routinely, and so say in your grocery store or your restaurant, those kinds of things, the modifications are based on those kinds of settings in general, and so you know, and it doesn't take into consideration. It's basically in that situation, it's indoor or outdoor. It's not so much air exchange in those public kinds of settings.
Yeah, with health facilities.
I just wanted to clear the air on that.
Excuse the pun. Well, with health facilities, we go by the OSHPD, Office of Statewide Health Planning, requirements for air exchanges. Even so, in this environment, I know that we've tested our rooms to see what the air exchange levels are, because if we do have a potential patient who may be COVID, we have to determine how long that room needs to stay untouched and then cleaned. So, and every building is slightly different depending on the age at the time the standards were developed. So we have buildings that are 30 years old. We have buildings that were built last year. So, it's, and the rooms are small, so it's not big open air areas. So I can see on the commercial side, it's not really built that way. And it would be, I think, really difficult to, you know, to make big changes there without a lot of money and investment. So,
Thank you, Dean.
welcome.
Any other questions? Going once, going twice. All right. Well, thank you all for being here with us today. We will see you again next week, Wednesday, 11 a.m. Everybody have a safe and healthy week.